Okay, let's get started. So good morning, good afternoon, everybody. Thank you for joining us today for the HuMEL learning session on outcome measurement. My name is Linda Steinbach, and I'm the Global Head of Humanitarian Evidence and Learning in Save the Children International. And I am joined by Alison Simmerly, who is the meal advisor for Catholic Relief Services, and both of us are the HuMEL co-leads for this initiative to make sure that we bring you the topics that you're excited to explore and learn from each other, and have a space where we can discuss key topics that we're faced with in humanitarian settings. So if we can go back one slide, sorry. Just a little reminder, if when you want to speak, if you wouldn't mind coming on video, it's always nice to see everybody. And when you're not speaking, if you wouldn't mind muting. And during the Q&A, please feel free to raise your hand. There's also the Q&A function in Zoom. So you can put your questions in there. And then if you have any comments or anything you want to contribute to the conversation, please feel free to put that into the chat box.
Chat box. Що чат-бокси?
Super. If you've just joined us, if you wouldn't mind muting, that would be very helpful. Thank you. And you're very welcome to join us in the AHA slides that Bella has put into the chat, so you can follow along. So let's kick off by understanding together what we mean by outcome monitoring in humanitarian settings. So if you can just imagine you're building a bridge, you wouldn't just lay down the bricks and walk away, right? You'd want to know if it's strong enough, if it serves its purpose, if people can safely cross it. And that's exactly what we do, what outcome monitoring is all about. In this case, in the context of humanitarian aid. And so in simple terms, outcome monitoring is the systematic gathering and analysis of data to assess the real world impact of our interventions. Are we actually improving children's health? Are we making water more accessible? Are we enhancing food security? And really, it's our ethical compass guiding us to be accountable, adaptive, and transparent. So it's not just about counting the number of hygiene kits we've distributed. It's really about understanding if those kits have actually improved people's lives. And as many of you have experienced, this is not an easy thing to do. So in our hour together, we will hopefully keep this definition of outcome monitoring in our minds as the backbone that ensures our humanitarian efforts are effective, ethical, and impactful. So today we're going to really go through quite an interactive session today. A lot of participation, I'm hoping, from all of you. There's a lot of expertise in the room, and we are really excited to explore it with you. So if you wouldn't mind putting into the AHA, let me just see here. If you can put in your definition of outcome monitoring as we are coming into this, yes. So an activity to measure some outcome indicators after a certain period of time, absolutely. Checking on early signs of intended higher level change and results. And I see people are typing. Yep, measuring outcomes. Seeing if you've made people's lives better. Absolutely. Keep those coming. We will provide a summary of this at the end of the webinar for those who weren't able to join. So please feel free to keep adding. So if we can move to the next slide, we're going to delve into some of the key challenges that we encounter in outcome monitoring within humanitarian contexts. And these challenges are not just theoretical, they have real life implications that can significantly impact the effectiveness of our interventions. So some of the challenges that we have encountered is a very obvious one, but the fact that we are operating in insecure environments. One of the most difficult and immediate challenges are the operating environments. The risk of violence or instability often hampers our ability to collect reliable data, making it difficult to assess the impact of our work. And often we have resource constraints. And they can prove to be a significant hurdle. The lack of human and financial resources can severely limit the scope and the quality of our monitoring efforts. It can also affect the decisions that we are making. We're also in a situation where the humanitarian landscape is increasingly complex. With crises evolving rapidly, defining clear outcomes becomes a bit of a moving target, complicating our monitoring efforts. And we also have traditional frameworks that can often fall short in addressing the unique challenges of our humanitarian projects, especially those that are short-term and complex. And this inadequacy can lead to ineffective monitoring. So it's something we really do need to keep an eye on as professionals. We also have to operate under extremely tight timelines. I don't know how many of you have been in situations where you've got multiple things going on at the same time, and being able to meet expectations and show quick results can be very challenging. And this can lead to a focus on easily measurable outcomes at the expense of more meaningful and long-term impacts or more lasting outcomes. And I've experienced myself that the absence of baseline data and comprehensive data collection methods can also create significant gaps in our understanding, affecting the accuracy of our monitoring. So one thing that we often talk about is even when we do collect data, limited resources often make it difficult to confidently attribute observed changes to our specific interventions. And this is something that has been raised actually with colleagues that I've been speaking to today in a meeting we're having, is how do we make sure that we're considering standard metrics when it comes to a global organization like many of us work in, or local organizations where we're trying to ensure that we can compare certain types of data, but we know that that can be an extremely challenging endeavor. And even to leverage secondary data for our projects can be very difficult. We've got language barriers, especially in regions with diverse dialects. It can limit the quality of the data we're collecting, affecting the reliability of our outcome monitoring. And also, finally, there are sometimes assumptions that all HuMEL staff and partners know how to conduct outcome measurement, and therefore we might skip training and get into situations where there's not always a clear understanding of what the indicator definitions are. So this insufficient knowledge can also hamper our ability to produce good quality data. So in summary, these challenges are all interconnected. If you can see the web of connections that I have tried to illustrate there with a few examples, and this is by no means an exhaustive list. I'm sure many of you may have ideas of more, have experienced more, but it does show us the critical nature of us being able to address them in a holistic manner. So looking at things in the bigger picture. You'll see a poll asking you to rank which of these challenges listed posed are the greatest to the least challenge for you. We'd love to hear from you about what is it that what's your reality? There we go. Great. So we're seeing resource constraints, the complex humanitarian landscape as for the moment, from the ones that we see so far who've submitted. Methodological limitations coming up high there. Yes, we will be sharing the slides after the webinar and the recording as well. Okay, great. We're starting to see more inputs here. So attribution challenges being one, also a very high limitation or challenge people are faced with. I'm actually quite surprised about the lack of standardized metrics, because that is something that is in deep discussion in Save the Children at the moment. We're working hard to try and see how we do that better. Consistent measures. Okay. Thank you for sharing your greatest challenges. And I'm hoping that in the next segment, we'll be able to unpack that more together. So we could move to maybe the next slide. Okay, so the least challenging. So which of these from the list are the ones that you find least challenging in your context or in your organization? Language barriers least challenging, all right. Data gaps. Okay. That's interesting. Does anyone want to share if it's because you found mitigation ways to make these the least challenging? Did they used to be the most challenging and now they're the least because you found mitigation actions? Anybody would like to come off mute? If not, you're welcome to put in the chat as well. Okay, it looks like that people are prioritizing training of outcome measurement and how to measure different outcome indicators, which is great if it's one of your least challenging situations. Okay. Let's perhaps move to the next slide so we can hear more from the group. So what we're going to do, I don't know, Bella, if we can move to the scenarios. Here we go. Okay, so what we're going to do together is we'd love to hear from you a little bit more. So I'm going to share with you a few scenarios, and we'd love to hear about how you would adapt and enhance program interventions based on outcome results. So what you'll see on the screen is you'll be able to share with us what your take is from the poll options that you'll see on the screen. Okay, so we'll start with the first scenario. So you are conducting an N-line survey for a WASH response, which included hygiene promotion activities in a flood-affected area. And findings show that 100% of households have soap and water available at a hand washing station near the latrine. You are surprised by this finding because there were no sanitation or WASH NFI activities in the project, and the baseline results were quite low. So we'd love to hear from you. What other methods would you recommend in order to identify gaps and provide recommendations on how to adjust programming? So would you use qualitative methods like focus group discussions to explore survey results? Would you conduct a real-time evaluation? Integrate light monitoring activities into your meal plan? Or if you have any other ideas, what would you say? And if you would like to come off mute to share with us the reasoning behind your answer, you're very welcome to. So would anyone like to share with us a little bit more about using qualitative methods like focus group discussions to explore survey results in this scenario? Ola, please. Hello.
Hello all. Yes,
Hello,
sorry.
please. Hi.
Yeah. Hello. Hi. This is Ala, meal manager from Save the Children. If it's come to me this situation, I'll go first. Either I think the choices are all are good and it could be uh, done. But first, like integrate a light monitoring activity into meal plan. If it is, and this is, but this is done with a different team. Like if you have this is if you are doing the activity with a partner and partner who provide you with this information, then go with your field team. Like if in our situation we have a field team related to Save the Children, so I can just send them and verify with the same tool. So maybe taking a sample size from the same tool that it is has been collected, and but other people to collect it, maybe that team. If it is not this situation, so if it is the same team that will come this or collect this information, then I'll go to the qualitative method, like focus group discussion. People provide more in the open discussion, maybe provide more information. Another organization has already do this activity and providing them, but maybe our tool, this question is not included. So that's from my side.
Thank you so much for sharing that.
Yeah, and if we come to the evaluation, it could be done an evaluation if it's we need for an in-depth evaluation, but it's also that because it needs more budget, and we need to allocate a budget for it.
Absolutely. It's often where we fall short. We don't have enough budget to do all the measurements that have been put into the log frame or what was agreed with the donor. Thank you for sharing that. Shaima, would you like to come off mute to share with us what you've written in the chat so we can see another nice face, friendly face?
Yeah, thank you. Can you hear me?
Yes, can hear you.
Okay, so just if we go back to the slide, like I believe that our program was just hygiene promotion. And there was no NFI kits distribution and no sanitation, right?
Mm-hmm.
So I would probably love to explore the baseline tool and to check the questionnaire and the items that were there, also the endline tool. Like most probably there will be items to measure the knowledge, probably the practices, and maximum the attitudes, not a CAP probably tool. So asking for SOAP and things that were distributed and were not implemented by our programs, that would not be a smart question. So the method of this endline assessment would be like an activity or a task to me to explore.
Thank you,
Because
Sharma.
the assessment or the outcome monitoring should be tailored to what we implemented. As you mentioned in the challenges, one of the challenges is the attribution factor. So we want to make sure as much as we can to attribute the change to us due to our intervention. Thank you, over.
Thanks so much for sharing that. Okay, anybody else would like to share their thoughts, or should we move to the next scenario? Okay, Martin, my connectivity is terrible. Qualitative tools, focus groups, KIs are good for triangulation. Absolutely, yes. Okay. Maybe, Bella, we can move to the next scenario and see if we can entice. Oh, Wilson, sorry, I didn't see your hand there. Go ahead.
Yeah, no worries. This is just a broader question. Everybody says behavior change is difficult and takes time, and yet we often include hygiene promotion, which is behavior change in emergency projects. I guess, do people have experience having really rapid behavior change in hygiene behaviors in 1 year or less? And especially in emergency context, I'm just curious.
That's a great question. I wonder if we could share some knowledge from the group that are on the call. Would anybody like to share their experiences on that before I share mine? So it's about how we go about measuring behavior change in humanitarian settings.
And then is it even possible? I mean, you have
Is it
6-month,
possible?
1 year
Yeah.
projects, like,
Yes,
is that enough time? Yeah.
I just want to mention that in terms of BHA, the indicators that we have is just knowledge, no practice. They said the number of people, percent of people that know at least 3 of the
Key messages.
the messages. I mean, we are measuring just knowledge. We are not measuring practices. However, we have tried to measure, to compare how much. You added another question saying, because the question is how many you know, but then we ask another question saying how many of those are you practicing? So then you try to compare the knowledge with the actual practices. That is, at least we have tried in 1 year period.
Yeah, I completely agree. I think in humanitarian settings, we have indicators that we're able to measure. And you're absolutely right, that it is a lot to do with knowledge rather than the next step, which is practice. In Save the Children, what we've done is where there is communities that we've worked in before the emergency, and we're continuing support afterward. It might be the addition that we would put into an ongoing project or a continuing project that we have with that particular group of people or in that community. Lloyd, please.
Yeah, I was just going to echo exactly what you and Nestor had both said, just that, the CAP surveys and then ongoing. I think what's important is people oftentimes think of humanitarian settings and contexts and these responses as a one-time event, but in practice, they're not. They're cyclical that go on, for often, unfortunately, decades. And so while maybe your project isn't necessarily measuring outcomes around these behavior changes, the next one and the next one, and as they implement kind of these ex posts looking backwards on the effectiveness of different interventions. So sometimes there's a larger kind of strategy at play there, I think, especially in these protracted crises settings.
Thanks, Lloyd. Wilson?
Yeah, thanks for sharing, everybody. And then my follow-on question would be, for hand washing, like, I feel like if you've received enough hygiene messages, you know what the right answer is. And there's no way that an NGO is going to be able to watch me wash my hands. So is that reliable data? And then if you do have these protracted data of protracted crises and follow-on projects, I might be receiving hygiene promotion, the same training multiple times. So I already know the answer. So I just guess, like, you know, maybe we can never really know if people are washing their hands, but has anybody ever tried looking at like health outcomes, like actual like cholera rates or I don't know, like hospital clinic intakes? Like, has anybody used that data to measure like what hygiene promotion should eventually lead to, just like better health outcomes? Over.
Great question. Anybody have any response to Wilson's query there?
I think it will depends, because we can, I mean, in a humanitarian setting, we're saying it depends what other strategy you are doing, because just washing hands is not going to not going to impact in 6 months, as he said. It depends what is the strategy of the program. If it's just not only promoting hand washing, but all the things that will contribute to decrease, because otherwise you will put that outcome. And I have seen people like want to decrease diarrhea and a lot of percentage points in a very short term period, and I have seen that have been fail. It will depend on the strategy. You know, I have seen programs that with very aggressive strategy, using media, using different other part of the strategy, so they have got great results. Like in Central America, I just come to my mind. You know, when they work with other actors, it was a big, strong campaign. But I think it depends on the strategy that the program is putting in, just not only washing hands.
Right. And Shaima's actually put into the chat, usually in UNICEF projects that relate wash hygiene promotion outcomes to prevalence of diarrhea rates amongst children in a particular camp. Thank you. Thanks everybody for the engagement with that scenario. Maybe Bella, we can move on to, we have more for you. We can skip past this one to scenario 3, maybe Bella. Okay. So you're supporting your organization to prepare for phase 2 of a psychosocial support program for children in an IDP camp. The first phase of the program found that participation in activities at the child-friendly space were low, with only 20% of children in the area attending. You've heard that that more boys than girls, girls than boys were attending. So you're going to see a poll in a second. How would you support the project team to learn from phase 1 in order to ensure that phase 2 meets its objective of improving children's well-being? And the proposal for phase 2 is due in a week. What are your thoughts? And if you're willing to unmute and maybe share some of your experiences where you've had a similar situation to this, or explain why you would choose this particular methodology. Thanks, Alison, for putting that in.
Can I comment on that?
Of course, yeah.
Yeah, as a meal, if you have a gender focal person, so the first thing that you'll do involve the gender focal person in the organization on that. Maybe that he has the knowledge about the areas and the gender sensitivity of the area. The gender focal person can advise on maybe he can give an answer, or he can advise in how we can investigate more from the community. So why boys are not involved similarly as carers? This could be, I would like after action review, but yeah, it could be after action review. And it could be here, it could be an FGD. It is to choose another, so I can say FGD with the community, the caregivers.
Sorry, I was on mute. Thank you for sharing that. And when we're talking about conducting an after action review, who are we thinking about when who are we planning to talk with? Who do you think is valuable to make sure we're interacting with from this perspective?
For us, after action review usually is just internal, like our own team, and making sure that we have, if it's only our internal team, then having a diverse perspective, like people who work in the child-friendly spaces, who are regular talking to community members, as well as others. But that, I mean, I picked this one mostly because you said we only have a week, and I want to say the method for after action review is usually a day, maybe 2 max, and doesn't require data collection. But of course, this seems like a big problem because it's only 20%. So if you had more time, an evaluation where you go out and collect data would be better.
Yeah, absolutely. I mean, often we would go internal. That's true, especially with time restraints. What we've done in some of our programs is we've tried to prioritize the facilitators in the child-friendly space, for example. So what are they noticing are some of the barriers that they're observing, and how they would recommend increasing attendance, for example, and understanding what our monitoring data was showing us throughout the program. So were there some indications of some barriers for why girls were coming more than boys, for example? So often we try and like look at that point in time of when the project is ending, but then maybe not looking back on the monitoring data that we've been collecting for all that time, and to help give an idea, at least, of what the potential barriers could be. Anybody have any comments on that, Clara?
Thanks a lot, Linda and all, for this good discussion. I would select after action review because it helps us get at unanticipated changes, hopefully, as much as anticipated changes. So I feel like in the humanitarian context, when we're looking at outcome measures, we have to really be careful that we balance what we know we want to look for versus looking for things we didn't anticipate. So among these options, that looks like a good one. So just wanted to emphasize the importance of looking for changes we didn't anticipate, those we want and those we didn't want to see.
Thank you so much. Great. Anybody else want to add anything before we move to the next one?
For me, I would do both, reanalyze previous monitoring data to see if there is any mistakes, if there is double counting to see something, and then conduct, even parallel, we can conduct the after action review. As you mentioned, I not only, if it's possible, not only include the facilitator, you said, in the places, but if there is any other volunteers or maybe even some key informants that can tell us why boys have not attended the center. So
yeah, absolutely. Yeah. Great. Thank you, everybody. Should we move to the next scenario? We've got a few more exciting ones. So you're a meal professional monitoring a multi-purpose cash assistance program, so MPCA distributions, through a remote post-distribution monitoring exercise conducted 3 weeks following the distribution, your team finds that 5% of respondents reported that the assistance received was seized by the local government. I see someone's put a shocked face in the reaction. So as a meal professional, how would you adapt your meal plan for future distributions? If you're undecided with what other information would you want, you can put that into the chat specifically if you have any other ideas. So would you adjust your sampling strategy? Would you use additional methods to get more information? Would you strengthen feedback and response mechanisms? Or do you have any other suggestions? And again, feel free to unmute and share with us your thoughts. Okay, interesting. Strengthening feedback and response mechanisms. Anybody want to unpack that a little together? Don't be shy. At least 8 of you put it in there. Like, where was the complaint desk from first distribution? Yeah. Any thoughts? So 5% of respondents reported the assistance received was seized by the local government. How would you triangulate that information? Like, how would you triangulate that information? So the PDM is one source of data. Who would you be partnering with, and what would you be looking to explore with those people to get down to the bottom of that? Anyone?
Hi, can you hear me?
Yes. Hi, Sarah.
Hi. So, firstly, you're saying remote monitoring through the remote PDMs conducted 3 weeks following the distribution. So, are you sure about, the quality of your data? In any case, you've also done it remotely. So probably we can't be too confident to report about it, about such a sensitive thing, let me call it sensitive, without being able to back it up. Because remember, you're going to maybe share this openly, let's say in the cluster meetings.
Yeah.
Or you're gonna share your experience in the cash consortium. I'm working in Somalia, so we have a cash working group. And so if you're going to talk about 5% of the respondents, it is okay to talk about this, but you had better be sure 100%, so that when you're bringing it forward, then people people in the sector have enough evidence to be able to do something about it. So the point is checking, triangulating, okay, so to speak, like you had mentioned. But it will be an interesting finding, especially once triangulated and you can stand and confidently defend it. And then on the basis of which, the sector has, information to do something about it, let alone yourself as an organization in the next round of the MPCA. Thank you very much.
Thanks so much, Sarah, for sharing that. And honestly, it is, that's the only way we can be confident, is to be able to triangulate. So what would be, say, our go-to sources of information in terms of triangulation? So I guess one would probably be our own operations teams to see if there are any other reports, let's say, in our feedback and response mechanisms, perhaps, to see if there are any surrounding trends.
Let me again speak for Somalia in particular, because the MPCA tends to be, you know, mobile money based. So maybe it's a bit sensitive. Maybe you could liaise with a telecom company, because if they are claiming that the government seized the money, a percentage, it means that they transferred electronically, ideally, right? Because they can't go and exchange that for cash and then distribute that to the government. So maybe even at that point, you want to ask them, you know, try and probe further. There's a possibility, although it can get a bit sensitive, because remember, it would mean that we go back to the sample, the 5%, and sample the 5%, and then ask, I don't know, their telephone number. I don't know, but you get the train of thought. Eh?
Yeah, absolutely.
And
I
that's the
think it
interesting
really
thing about
depends.
M&E. I mean, it's not clear, it's not black and white. There's always, you know.
Yeah, it's always
Yeah.
the gray. And even looking at the modality of the cash transfer, whether it was by hand, whether it was electronic, all of those aspects are things we would need to look in based on the context. Thanks, Sarah. I see Shaima suggested I would zoom in to those 5% respondents by interviewing them to know the whys and the hows, and maybe we can amend the MPCA modality with them in particular. Yeah, I think it's good to dig a little bit deeper to verify perhaps and see whether it's in a particular area, for example, or if it's concentrated in one area where there seems to be a consistent thing in the location, or if that trend doesn't seem to be, and it's it's spread across the region. You could also oversample in that geography in the next PDM, absolutely. How has US aid handled a similar issue recently reported in Somalia? I don't know, Sarah, if you have experience in that. If you want to respond to George in the chat, please feel free to. Okay, I'm just aware of time. Thank you so much for the engagement. Maybe we can do perhaps one more, and then we will start to wrap up. So your team conducted a midterm evaluation of a shelter response in an earthquake affected area. Preliminary findings suggest that only half of the participants received distributed construction materials to repair their homes. So going forward, how would you modify your monitoring approach to ensure assistance reaches the intended recipients? Would you add new performance indicators? Would you use GIS tracking for material distributions? Would you conduct an on-site monitoring of the distribution points, or do you have any other ideas of how you might address this? Bella, I think the submission thing is locked. I don't know if you can unlock it. Perfect, thank you. So whoever clicked other, tell me, what are you thinking?
Yeah, I picked other. I mean, in my mind, I'm imagining that people are coming to a distribution point. So if they're not even coming, then you can monitor the distribution point. You don't know why they're not coming. You can use GIS, but nobody's coming to pick them up. And I feel like adding performance indicators wouldn't help either. So in my mind, the issue is that people just aren't showing up to pick up materials.
Yeah, absolutely. So we need to find out where they all are and what's holding them back.
Yeah.
Thanks, Wilson. Any other thoughts? For those who said conduct on-site monitoring of distribution points, what are you looking out for?
To see if the people are actually receiving the amount of material that was supposed to be received. So to check if in this the distribution point, at least there is something that show that everybody knows what material they are going to receive. And then also, it'll be good to do randomly some visits on, because they can receive the material, but they can also sell the materials. So, and then people say, I haven't received it. Unfortunately, it's very tricky because always people have the tendency to say, no, I don't know.
I don't know.
Never told me. No, they didn't say me this. So we need to be very, very careful when we found this kind of information, because sometimes we can just go and say, oh, somebody is stealing here. It must not be the case. It could be, but I think we need to go and do more research to see it's actually what is going on there.
Exactly. Thank you. Great. For time, let's skip on to one of the last slides. I think that all of the things that all of you raised, and through the scenarios, we had a few more scenarios that I was keen to share with you, but for time, I would actually like to come to Q&A, and we can share with you those scenarios with you actually after the webinar as well, so you can have a think about them on your own. But I'm going to open the floor to any questions you might have for each other, for myself, for Alison, before we give you a little bit of a sneak peek into what we've got in mind for our next webinar that's very much connected to outcome measurement, and is a very hot topic in the humanitarian world and development world, actually. Feel free to unmute and jump in if you have answers to the questions as well. Doesn't always have to be me and Alison. Wilson, go ahead.
Yeah, this is just a question for my own work challenges. We work with refugees and migrants and integration. So has anybody successfully or measured integration as an outcome? And relatedly, has anybody ever used qualitative indicators for outcome measurement? That's all. Thank you.
Thanks, Wilson. Anybody have any experiences they'd like to share with Wilson before I jump in? Clara, I love qualitative indicators. Great question. Does that mean, Clara, you have some experience with that you'd be willing to share?
Linda, that's a great point. I just would share that I'm looking at things like social cohesion and other higher level outcomes, and we have a qualitative and a quantitative indicator at those levels. I feel like that's a great balance, and it also pushes us to make sure that our methods are mixed, because we often design for the indicator. So if we just have a quantitative indicator, then we often miss the opportunity to engage in a qualitative manner. So it was just to note, it's a great question, and I think that's the right entry point to get at some of these unintended changes and look at some of the things that are harder to count, but maybe most important and sustained. Thanks.
Thanks, Clara. Anybody else have experience in measuring integration? Maybe I can just share, measuring integration is one of the hardest things that we keep stumbling on in not just humanitarian context, but in general. Where we have been more successful is when it's not like very complex or compounded indicator measurement. So if it's two sectors or two types of modalities, say if it's cash and protection, they seem to be a lot easier to measure than if it was, a child attending a school where there are child protection programs happening in the school and they're also provided with cash. So the more complicated the project or the type of interventions, the type of combination intervention, the more difficult it is to attribute all of those factors to the specific, or those three examples. But where we have found it more easy, I would say, is when it's related to, say, nutrition and cash, child protection and cash, nutrition and child protection, actually, because of the design, from the design stage of what it is that we are combining in terms of those interventions. But more than two, we found very, very difficult to do. I don't know if others have had greater success with that. Or Wilson, curious to know if there's something specific, or are you going for 3-sector intervention, or?
No, nothing specific, but I think you made me also rethink the problem of attribution, which I think has kind of slipped from my mind recently. So thank you for helping me think about that again.
Great, I'd be happy to connect with you offline to share with you what we have. Okay, so the question we see here is outcome measurement and outcome harvesting are not the same thing, actually. So outcome measurement is our systematic way to assess the results of activities over a specified time period, and outcome harvesting, from what I understand, on the other hand, collects evidence of what has changed and works backwards. So to determine whether and how an intervention contributed to those changes that we set out. So that's how I've understood and understood the differences between the two and what we've done with that. Okay, I would like to hand over to Alison to give her a little bit of time to tease you into the next webinar we have planned. But just want to say a huge thank you to you. And for those we didn't get to your questions, we'll put that into the follow-up email with the presentation and the recording. But over to you, Alison.
Thanks, Linda, and thanks everyone for the great engagement today. I just wanted to take a brief moment before we leave the session to preview our next HuMEL meeting in November, date to be decided still. But as a follow-up to our outcome measurement learning session today, we plan to host a workshop on crafting compelling stories using evidence. So once we've measured outcomes, maybe using some of the methods we've discussed today, how do we tell that story in a way that captures the reader's attention? So at the end of this hour-long workshop, our hope is that you'll come away with some ideas and drafts for writing some really interesting stories. And the timing of this topic is intentionally aligned with reporting season, in case that's useful for you in your report writing endeavors. And we'd really like to highlight the stories and experiences of partner organizations here. So we'd love your help in identifying any organizations that come to mind that do a really great job telling their story. And I will drop a link in the chat to a form where you can submit those. And Clara, that's a great point. Clara notes that the AEA sessions in November are focused on the power of story. So it's a nice pairing. All right, sharing that link in the chat now. Thank you so much for coming, everybody. This was a great session. All right. And yeah, as always, if anyone has questions, concerns, feedback, feel free to reach out to our Gmail address as well. See you next time.